you have itchy eyes, congestion, sneezing, usually sneezing fits, those are all symptoms of allergies, and you can do some things to avoid them. That's the main thing you want to do, is try to avoid those things that you have sensitivity to. So for things like dust mites, for instance, you want to make sure you don't have lots of fabrics around that can harbor dust mites. You want to wash your beddings and other things like pillows, stuffed animals in hot water, and you want to do that weekly. You want to keep the humidity in your house low, and that's for not only dust mites, but for mold as well if you have that sensitivity. Usually we recommend below 55% humidity. For pet dander, if you have allergens to that, you want to keep them out of the room, clean your carpets regularly. You don't want them to sleep in the bed with you. Also, if you have sensitivities to pollens outside during that pollen season, you might want to avoid doing some of the yard work, cutting ragweed down and things like that. Let's say you've been outside and now you've come inside and you are starting to feel like you're going to start having allergy symptoms. So one thing to do is take off the clothes that you are wearing outside and wash those. You can also take a shower to clean those pollens off of you so that you aren't continually sensitized to that particular allergen. And then you can use your medications. Things like decongestants can help once the congestion has started, and those can come in different forms, including nasal sprays or oral medication. Now, antihistamines can also prevent those symptoms from occurring, whereas decongestants cannot. If your symptoms to your allergies include itchy eyes, you can use eye drops for those, and we have over-the-counter products as well as prescription products. One thing I have my patients do is put the eye drops in the refrigerator, and then when they have the itchy eyes, to put a drop in the corner of the eye and let it roll in, and it also will be relieving to get that coldness in your eyes. Before you start any new medication, you want to make sure you speak to your doctor to make sure it's safe for you, even if you don't need a prescription for it.